Good evening, sir. We can start, sir.
Okay, good evening, everybody. Happy Makara Sankranti to all.
Good evening. How are you?
I'm fine, sir. How are you?
I'm fine, yeah. Good evening,
Okay.
Dr. Majumdar. You're muted.
Unmuted. Yes, I unmuted myself.
Yes, it's very good evening. Yeah. So it's
Can we start,
exactly
sir?
6:30 now. Yeah, sure.
Yeah. So welcome all. Good evening. Welcome all. And I welcome you to this Environmental and Occupational Health DG Connect webinar, Series 1, Issue 87. Today we have two eminent speakers with us. First will be Dr. Rajiv Jain, who will be speaking on the topic COVID-19 EP updates, episode 52. And then we have our guest speaker, Dr. Dhurjati Majumdar, is the founder Ergosol, who will be speaking on the topic ergonomics and industries. So two very, very good topics, the current topics, and it will be very interesting. To start with, let us start with Dr. Rajiv Jain with a brief introduction. Of course, Dr. Rajiv Jain doesn't require any introduction in the wide circles in India, but still let me give a very, very brief introduction of him. Dr. Rajiv Jain is a senior consultant health, Indian Railways, New Delhi. He has got over 40 years of experience in health and hospital administration. He has got Fellow Award of Indian Public Health Association. He has got Fellow Award of Association of Environment and Occupational Health, Delhi. He has published and presented more than 145 scientific papers in national, international conferences, journals, and books. He has got fellowships and scholarships by WHO, National Institute of Health, USA, Canadian Society for International Health, International Clinical Epidemiology Network, and International Society for Priorities in Healthcare. So to start with, let us start with Dr. Rajiv Jain. Sir, the floor is yours, sir.
Thank you, Dr. Guru Prasad, for that nice word that's spoken. We today evening on a Saturday, we are gathered here for the 52nd time to take a stock of the epidemiological situation of COVID-19. Epidemiology, as you know, tries to understand the distribution and evolution of a disease. But during pandemic times, all the more important it becomes to assess the epidemiological situation periodically to understand where we are and where we are going. Are we going right? If we are not going right, we need to take certain steps. We must take those steps and move forward so that pandemic remains a thing of the past. It does not remain a catastrophe which is going to affect the lives and livelihoods of human beings across the world. So as we do every week, we first of all hear the World Health Organization. Next slide, please. We will hear through a video the WHO Director General and the leads technical in WHO on health emergency program. So let's hear before we proceed further.
Update on COVID-19, and this huge spike in infections is being driven by the Omicron variant, which is rapidly replacing Delta in almost all countries. However, the number of weekly reported deaths has remained stable since October last year, at an average of 48,000 deaths a week. While the number of patients being hospitalized is increasing in most countries, it's not at the level seen in previous waves. This is possibly due to the reduced severity of Omicron, as well as widespread immunity from vaccination or previous infection. But let's be clear, while Omicron causes less severe disease than Delta, it remains a dangerous virus, particularly for those who are unvaccinated. My name is Christian Lindman. I'm welcoming you. We must not allow this virus a free ride or wave the white flag, especially when so many people around the world remain unvaccinated. In Africa, more than 85% of people are yet to receive a single dose of vaccine. We cannot end the acute phase of the pandemic unless we close this gap. We're making progress. In December, COVAX shipped more than double the number of doses it shipped in November, and in the coming days, we expect COVAX to ship its 1 billionth vaccine dose.
Codes. So again, thank you very much for joining and apologies.
Yesterday, TACOVAC emphasized the urgent need for broader access to the vaccines we have, and that further vaccines are needed that have a greater impact on preventing infection and transmission. Until such vaccines are developed, the composition of current COVID-19 vaccines may need to be updated to ensure they continue to provide WHO-recommended levels of protection against infection and disease. TACOVAC also said that a vaccination strategy based on repeated booster doses of the original vaccine composition is unlikely to be sustainable.
Variant in the next
because even though Omicron is less severe than Delta, it still is putting people in hospital. It is still putting people into ICU and needing advanced clinical care. It is still killing people. And so the more people that end up in hospital and fill up those beds from COVID-19, they take beds away from other emergencies that need to be cared for as well. And our healthcare systems around the world are significantly overburdened.
About the staggering infection rate. But on the other hand,
we're learning every day more and more about Omicron itself, how Omicron is introduced into a population, what the population level immunity is in that area, in that country, the vaccination coverage, et cetera. And we're seeing Omicron outcompete Delta in many populations where Omicron is becoming more prominent compared to Delta. To be able to predict what will happen in the spring depends on many different factors. And again, it is up to us how this pandemic unfolds. This virus is on its way to becoming endemic. There's no question about that. But we are very much right now in the middle of this pandemic. At transmission levels that we see right now, at the intensity of spread that we see, at the level of impact that these cases are having on our essential medical services, on essential services, on hospitalization rates, which are increasing in a number of countries. And now, certainly, we see less rates of hospitalization, but the sheer volume of cases is really putting a heavy burden on our healthcare systems. So the impact that we are seeing is really quite substantial.
Joining today, apologies for the
So you've seen how serious the situation is at the moment. We are very much in the middle of the pandemic, and we need to be on our guard. As WHO was saying, hospitalization remains low in Mumbai and Delhi, of course, but it is increasing. Experts the world over have said that Omicron variant of SARS-CoV-2 does not cause a massive spike in hospitalizations like the previous variants have. And real-world data from Indian cities appears to corroborate that. Data shows that hospitalization so far stayed far beyond what was prepared in Mumbai, in Delhi, the earlier urban hotspots of Delhi's third wave. A look at what hospitalization data in these cities show. In Mumbai, hospitalizations have begun to fall. 23% more beds available right now than 2 weeks ago. In Delhi, no drop yet, but enough safety net. 44% more beds available right now than 2 weeks ago. But what about those needing oxygen? In Mumbai, patients on oxygen support saw a big spike in the first week of 2022. From 821 patients on oxygen support, the number jumped to 3,129 in just 9 days. However, as general hospitalizations, these have also started dropping. On Wednesday, the figure was 2,746 COVID patients on oxygen support. As with regular hospitalizations, the number of people on oxygen support have not yet started declining. But a key distinction between the two cities is in absolute numbers. Delhi has less than a third of the number of people on oxygen support today than that in Mumbai. Next slide, please. WHO recommends 2 new drugs to treat patients with COVID-19. Recommendations are based on new evidence from 7 trials involving over 4,000 patients with non-severe, severe, and critical COVID-19 infection. They are part of a living guideline developed by the World Health Organization with the methodological support of Magic Evidence Ecosystem Foundation to provide trustworthy guidance on the management of COVID-19 and help doctors make better decisions with their patients. Living guidelines are useful in fast-moving research areas like COVID-19 because they allow researchers to update previously vetted and peer-reviewed evidence summaries as new information becomes available. To make their recommendations, the panel considered a combination of evidence assessing relative benefits and harms, values and preferences, and feasibility issues. Next slide, please. The drug baricitinib, a type of drug known as a Janus kinase, that is JAK inhibitor, also used to treat rheumatoid arthritis, is strongly recommended for patients with severe or critical COVID-19 in combination with corticosteroids, says a WHO guideline development group of international experts in the BMJ. Their strong recommendation is based on moderate certainty evidence that it improves survival and reduces the need for ventilation, with no observed increase in adverse effects. The WHO experts note that baricitinib has similar effects to other arthritis drugs called interleukin-6, that is IL-6 inhibitors. So when both are available, they suggest choosing one based on cost, availability, and clinician experience. It is not recommended to use both the drugs at the same time. However, the experts advise against the use of 2 other JAK inhibitors, that is ruxolitinib and tofacitinib, for patients with severe or critical COVID-19 because low certainty evidence from small trials failed to show benefit and suggests a possible increase in serious side effects with tofacitinib. Next slide, please. WHO also makes a conditional recommendation for the use of monoclonal antibody sotrovimab in patients with non-severe COVID-19, but only in those at highest risk of hospitalization, reflecting trivial benefits in those at lower risk. A similar recommendation has been made by the WHO for another monoclonal antibody drug, that is casirivimab, imdevimab. The experts also note that there was insufficient data to recommend one monoclonal antibody treatment over another, and they acknowledge that their effectiveness against new variants like Omicron is still uncertain. As such, they say guidelines for monoclonal antibodies will be updated when additional data becomes available. Next slide, please. These guidance also adds to previous recommendations for the use of interleukin-6 receptor blockers and systemic corticosteroids for patients with severe or critical COVID-19. Conditional recommendations for the use of casirivimab and imdevimab, another monoclonal antibody treatment in selected patients, and against the use of convalescent plasma, ivermectin, and hydroxychloroquine in patients with COVID-19, regardless of disease severity. So there is a new development having substantive value. Next slide, please. We look at another aspect of the pandemic, why lockdowns won't work in the third wave. The 7-day average of cases in India has been rising every day since December 27, or for 18 days, from 6,780 on December 27. The lowest this number has dropped since May 2020. It went to 1,93,418 on January 13. While average deaths were not rising initially, they have started inching to upwards since January 4 in states excluding Kerala. Does this mean we are headed for a crisis like the one seen during the second wave caused by the Delta variant? Should lockdown be imposed to reduce deaths? This analysis suggests that such measures may not be necessary and can actually hurt. Then we should look at these 4 charts. Let's have the next slide, please. First chart. Deaths said to be much lower than second wave despite Omicron's rapid rise in cases. The 7-day average of deaths at the national level does not seem to be increasing consistently, despite the average for cases increasing every day since December 27. This is simply because Kerala, which has accounted for over half the daily deaths in this period, has been reconciling its figures for past deaths that happened pre-Omicron on a daily basis. It therefore makes sense to look at numbers excluding Kerala. Taking a daily increase in average cases for 14 days as a marker for a wave's beginning, the second wave can be said to have begun outside of Kerala on February 12 last year, and the current wave on December 22. On the 23rd day of the wave, that 7-day average of the case fatality, that is CFR, deaths as a proportion of cases was 0.64% during the Delta wave last year, and is nearly a tenth of that, that is 0.07% in the Omicron wave. The low CFR is not simply because daily infections are low. Average cases outside of Kerala are already at 52% of the peak of the Delta wave, while average deaths are still at 3.3% of the peak of the Delta wave. Both these percentages will likely increase in the coming days as a rise in deaths generally sees a 2-week lag from cases. But if the CFR is comparatively much lower, it is most likely that deaths in absolute numbers will also considerably low, even if the current wave's peak matches the Delta wave. That is the current conclusion from the current trends. Next slide, please. Second aspect is caution is still needed, as hospitalizations can wreck finances of poor. To be sure, governments are correct in advising caution, despite the chances of lower fatalities in this wave. This is because hospitalizations, especially expensive ones, can put huge pressure on the finances of Indian households. The bottom 60% of the population pays for about 30% of the most expensive cases of hospitalizations, excluding childbirth, through borrowings or sale of physical assets, according to a 2017-18 survey by the National Statistical Office. The top 20% of the population does this in only 15% of the cases. So a major source of finance is depleted. Next slide, please. Third aspect is caution need not mean panic. However, advising or practicing caution does not mean that people need to be locked inside homes and businesses shut down. This is because while hospitalization are expensive, only a small number of people have needed it in the current wave. As CFR suggests, the share of infected people who reach that stage is likely to be small. In Delhi, for instance, where the current wave began on December 16, the 7-day average is already at 93% of the peak seen during the last waves. The number of people in hospitals or dedicated COVID-19 centers on January 13 at 2,969 was only 14% of the peak number of 21,154 during the last year's wave. Locking down indiscriminately in such a scenario can possibly hurt the state exchequer. If businesses don't make money, there will be less taxes to collect, more than paying for a small number of poor people's hospitalizations. And you see the graph of 7-day average daily cases and deaths and cases in hospital and COVID-19 centers and home isolation. Next slide, please. The fourth is, how can government tide over this wave? To be sure, even if the current wave does not result in a rush to hospitals, it can affect poor households disproportionately. This is because the poorest households depend disproportionately on casual work, where wages are negotiated on a daily basis and are too low for savings. If they isolate because of an infection for 2 weeks, they will likely need to borrow to survive. Even most self-employed people who earn better work without employing other people. Their businesses will suffer if they have to isolate. That's why it makes sense to not enforce lockdowns and instead insist on social distancing measures and masking. There are around 250,000 casual workers and close to 2 million self-employed people who do not employ others in the city-state, according to population projections for 2021 from the National Commission on Population and Workers' Proportions from the Periodic Labor Force Survey conducted in 2019-20. A lockdown will affect almost all of them. Next slide, please. Now we hear the Director General of ICMR for a new development, that is purposive testing strategy, and hear what he has to say about purposive testing strategy.
so much. Dear friends, I will now be talking about the purposive testing strategy for COVID-19. I'd say about 7-8 slides on that to give you a perspective on what it is. So I'll basically be talking about 4 issues. How we have significantly enhanced the availability of testing products in the country. They are huge in number and they are plenty, and we will talk. How the citizens have been empowered to get tests done easily, whether it is home antigen tests or rapid antigen tests or RT-PCR. And the purposive testing strategy, which was released 2 days back, which is clearly early detection. It is, the purpose of that is for early detection of symptomatic cases for quick care. Early detection of infection in the elderly with comorbidities for quick care. So that is the purpose of this testing strategy. And then I will talk 1 or 2 slides about how to detect Omicron and where we are other than gene sequencing. So now we have tested about 70 crore samples up till now, and we have about 3,128 testing laboratories with 205 RT-PCR kits that are being used. Rapid antigen kits are 53. Home antigen test kits are 7. And the daily RT-PCR testing capacity is about more than 20 lakhs as of the day. So what are the tests that are available? And I want that to be clear for everyone. We have the standard molecular test, which includes RT-PCR, CRISPR, and RT-LAMP, and that costs between 400 to 500 rupees. And you get the report in about 4 hours with this RT-PCR test. And I think by the 2 years of pandemic, everyone knows about this test. Then the second is the rapid molecular testing system, which are the closed systems, and they cost between 1,200 to 1,500 to 2,500. These are the ones which are faster than the RT-PCR tests, and you get the results in less than 2 hours, maybe 1.5 hours or so. And there are the CBNat, the Molbio TrueNat, Abbott ID, Thermo Fisher, and various other ones are there. So the examples are there. Then you have the lateral flow tests, and there are 2 of them. The lateral flow test, the most widely used across the world and also recommended by WHO for Omicron, is the rapid antigen test, which has a price between 50 rupees to 100 rupees and are available in plenty in the country. And then there's the home antigen tests, which are becoming more and more popular now, and several thousands are being consumed now every day in the last week or so, and they cost anywhere between 250 to 300 rupees. So 4 tests: standard molecular test, rapid molecular test, closed systems, and the lateral flow tests, which are the rapid antigen tests and the home antigen tests. Now, just want this slide to explain when does one become positive and what is the... So if you compare the molecular test with the lateral flow tests, which are the rapid antigen or the home antigen tests, they are marked with green when they detect from day 3 to day 8. They are able to detect it after exposure. So if you start at the beginning of the curve from day 0, you get exposed. So the first day you will test negative, whatever test you do. It takes time for the virus to grow in your system, so that is known as the latent period. And so from day 3 onwards, it will be detectable in the lateral flow tests and will be detectable up to day 8, which is the infectious period. Day 8 meaning after 1 day. That is why the discharge policy and all the home isolation policies are focusing on 7-day discharge. And that is how it explains the whole physiology or the pathology of the whole system. Now here I just want to remember that long red line, which is detectable by PCR, that continues to be positive even after day 8, because certain RNA particles which are non-infective, here remember, certain RNA particles which are non-infective will continue to be shed and will continue to be cause the RT-PCR test to be positive. So for Omicron, what has become the backbone is the lateral flow tests, with the PCR test also serving as confirmatory at some places where they are symptomatic individuals. When the lateral flow test is negative, then you may have to do a RT-PCR test, and I will come to that algorithm. So I hope this is clear in terms of how the virus is the curve, the black curve, how the virus load rises and then gradually falls, rises from day 2, goes up to a peak on day 5, and then gradually falls by day 7 or 8, and then peters away. So that is to understand it. Now, in terms of the diagnostic kits that have been validated and available by the ICMR system and the 24 validation centers across the country over the last 2 years, we have validated a total of, evaluated more than 1,598 products, and indigenous are 580 out of the 747 that have been approved, and the products are available, are nearing 2,000, and they are available on GEM. These are by different vendors available on GEM, whether it be viral transport media or RNA extraction kits or RT-PCR kits or rapid. And here on the right-hand side, if you look at the from March, April 2020, when the cost of RT-PCR test was 1,582 rupees, has now fallen to each of these products to be only 50 rupees, whether it's viral transport medium or RNA extraction or the RT-PCR kit itself, because of tremendous amount of competition and the excellent work by the young innovators who have developed startups in the country, and many of these kits are being exported to many parts of the world. Now, if you look at the production capacity per day for the RT-PCR kits, we have a production capacity of 71 lakh kits per day. And the rapid antigen test kits is about 79 lakhs per day. So that's both, if you combine the two of them, it's about 1.5 crore per day. And the home antigen test is about 18 lakh tests per day. So production capacity is plenty, kits are plenty, abundant in the country. So that is very important to remember. In terms of the home antigen kits, which are now becoming popular, they are available at chemists for people like you and me. There are people who are technologically savvy. It is available online. People who cannot afford it very easily are available in Jan Aushadhi stores, and it is people who want to distribute it. It is available on the government e-market. And these are the kits which are available. 7 of them are available, and their production capacity is on the extreme right-hand column. Total is 1.2 crore per week. So as I mentioned, 18 lakh per day, so about 1.2. This is a weekly production capacity of these kits. These are home antigen kits. And these have formed the backbone, the home antigen and the rapid antigen, in many of the Western nations. And the WHO has also kept it as one of the major recommendations in its guidelines. Now, this is about the kits, the availability, and how easily one can get it tested for any individual. But now let's come to the purposive testive strategy. Now, who may be tested? Number one, symptomatic individuals. So all symptomatic individuals in the community need be tested. All symptomatic individuals. All high-risk contacts of laboratory confirmed cases. All high-risk contacts. Now, what are those high-risk contacts? Elderly more than 60, comorbidities, diabetes, hypertension, lung disease, kidney disease, cancers, obesity. So this, all high-risk contacts need to be tested in a community. And then we are talking about international travel, and we will not talk, that is already mentioned. Then who may be tested in a hospital setting? Testing may be taken as per the discretion of the treating doctor, with one very important consideration, that no emergency procedure, including surgeries or deliveries, be delayed for lack of a test. And asymptomatic individuals undergoing surgical, non-surgical procedures, including pregnancy, in labor, who are hospitalized, should not be tested unless warranted or they have some symptoms of sore throat, breathlessness, fever, headache, etc. And who may not be tested. And these are all asymptomatic individuals in community settings who are asymptomatic. All asymptomatic contacts of confirmed cases of COVID-19, unless they are high risk based on age or comorbidities, which I have already mentioned. And patients who stand discharged as per home isolation guidelines, and Sri Lavji has already talked about that, and patients being discharged from COVID-19 facility as per revised discharge policy, that is very clear. And individuals traveling from Delhi to Bombay, or Bombay to Chennai, or Chennai to Calcutta. So all domestic interstate travel do not require. But the last point, which is most important to remember, is home quarantine for all contacts for 7 days. So if I have come here for work, I go back home and I test positive, all my relatives who are above 60 or comorbidities should be tested. All my children, etc., should not be tested, but have to be in home quarantine for 7 days. Have to be in home quarantine for 7 days as per guidelines, and continue to wear masks. So use of mask is vitally important when you are doing home quarantine. And then here is the algorithm for home test and rapid antigen, and this is very clear that if you are positive, you have to be reported as positive. If you are negative and you still have symptoms of fever, cough, or sore throat, then you have to definitely send the sample for RT-PCR testing. But most importantly, all positive and negative tests should be uploaded on the ICMR portal, whether it is home testing or rapid antigen tests. Now here are the home testing guidelines. These are available in 14 languages now. And here you have to remember that round circle, that oblong, which says that asymptomatic contacts to home quarantine for 7 days. Then you come to the second line. Symptomatic individuals will end home quarantine after at least 7 days have passed since testing positive, and afebrile for 3 consecutive days. Then you come to the left-hand side column. I won't run through the whole thing, but here asymptomatic family members exposed to symptomatic individuals should monitor health. Testing not mandatory for such individuals. So home isolation remains the cornerstone of treatment for. However, those who want to continue to test, home tests are available, rapid antigen tests are available, but this is the recommendation and the understanding. And then we have the don'ts, which I think anyone can download it. They are on the ICMR's website, they're on the Ministry of Health website, and they are in several languages. One pager on how to suspect it, what are the do's, and what are the don'ts. Then
So
I'll
you have
just
seen
change gears and come to 2 points. How do we detect?
How things have gone in terms of change in strategy for testing as the pandemic has evolved. ICMR this week has put in a very substantive, scientifically based evolutionary process, purposive testing strategy for COVID-19. And that should be followed by all the professionals in their community settings or in the workplaces or in their actual practice in the hospitals and health centers. Next slide, please. Well, this is today's position of confirmed cases, deaths, tests per million per day, 7-day average test positivity rate in percent, and growth of active cases in percent. On the left in the blue are the states-wise confirmed cases, and which are the top 5 states. Maharashtra, 43,000, Karnataka, 28,000, Delhi, 24,000, Tamil Nadu, 23,000, and West Bengal, 22,645. So top 5 states are Maharashtra, Karnataka, Delhi, Tamil Nadu, and West Bengal. In terms of deaths, total deaths were 397, out of which Kerala reported 199. Delhi, West Bengal, Tamil Nadu, and Punjab were the next 4 top states with deaths. If we see the tests per million per day, the top 5 states are Chandigarh, Mizoram, Goa, Jammu Kashmir, and Delhi. But look at the bottom 5 states: Himachal Pradesh, Nagaland, Arunachal, Manipur, and West Bengal. 7-day average test positivity rate in percentage, Indian average is 12.8%, while West Bengal is at the top with 32.5% test positivity rate, and Goa 30.9%, Delhi 25.7%, Himachal Pradesh 25.1%, Pondicherry 20.7%, and Maharashtra as well 20.4%. And growth of active cases in percent in India, it is 17.25% for the last 24 hours. But the top 5 states are Sikkim 44, Pondicherry 39, Tripura 35, Uttar Pradesh 31, Arunachal Pradesh 31, Odisha 30, Uttarakhand 30.05. And amongst these 4-5 top states with growth of active cases are 2 states going for elections. That is one, Uttar Pradesh, and second, Uttarakhand. So there is a need for close watch and containment measures, tracking of cases, and effective testing strategy implementation on the ground. As we are seeing, test positivity rate is increasing, active cases are growing, and total deaths are increasing. Next slide, please. This is the Southeast Asia region position for the past 7 days. During the past week, the Southeast Asia region reported 699,000 new death cases, a 418% increase, an incidence not seen since mid-August 2021. 7 countries, that is 78%, reported large increases of over 50%, with the highest increases reported from India, Timor-Leste, and Bangladesh. The highest numbers of new cases were reported from India, 638,000, and 524% increase. Thailand, a 125% increase. The number of deaths, however, declined in the past week. Over 2,300 new deaths reported, a 6% decrease as compared to the week. The highest number of new deaths were reported from India, 2,020 new deaths, which is similar to the previous week, and Thailand, 105 new deaths with 25% decrease, and Sri Lanka, 100 new deaths and 26% decrease. Next slide, please. Yes, this is the global pandemic graph. And what do you see? You see globally the number of new cases increased markedly in the past week, while the number of new deaths remained similar to that of the previous week. Across the 6 regions, over 15 million new cases were reported this past week, a 55% increase as compared to the previous week, and 43,000 new deaths were reported. As of 9th of January, over 304 million confirmed cases and over 5.4 million deaths have been reported. All regions reported an increase in the incidence of weekly cases, with the exception of the African region, which reported an 11% decrease. The Southeast Asia region reported the largest increase in new cases last week, of 418%, followed by the Western Pacific region, 122%, the Eastern Mediterranean region, 86%, the region of the Americas, 78%, and the European region, 31%. New weekly deaths increased in the African region, 4%, and the region of the Americas, 26%. The number of new deaths remained similar to that of the previous week in the Western Pacific region, while a decrease was reported in the Eastern Mediterranean region, 11%, the Eastern European region, 10%, and the Southeast Asia region, 6%. Next slide, please. Here you see newly reported and cumulative COVID-19 confirmed cases and deaths by the WHO regions across the regions you're seeing. Total 55% increase, and largest contribution at 7%, Americas 40%, and the third is Western Pacific 5% and Southeast Asia 5%. In terms of deaths, the largest contribution still is from Europe 48%, Americas 33%, and the rest from other regions of the world. So the pandemic is very much there in Europe and Americas in its most severe form, both in terms of cases and in terms of deaths. Next slide, please. This is the Institute of Health Metrics and Health an evaluation, 52% estimated global infections have been there. Fully vaccinated is, you can see the map of the world in terms of colors, less than 10% in orange, and the whole of South Africa is in bad shape in terms of vaccination, while it is good in patches in Americas and in China. If you see past week, there was increase of 57.7% in daily cases and decrease of daily reported deaths of minus 1.5%, and daily hospital census is increase of 32.2%. Cumulative deaths to date are 5.99 million. 55% are wearing masks, 19,000 lives savable with 80% mask use, and 339,000 additional deaths are expected, projected by May 1, 2022. Next slide, please. The Omicron wave has now reached most regions and countries across the globe. Estimated daily global infections are at approximately 124 million, which is 10 times the Delta wave peak of April 2021. However, there are a few places, including parts of Eastern Europe, most of Southeast Asia, and many islands in the Oceania, where it has not yet taken off. And conversely, there are multiple countries that have already peaked. The latter include most of Eastern and Southern Sub-Saharan Africa, the United Kingdom, Cyprus, Malta, Greece, Ireland, Italy, Canada, 19 states of the United States, the United Arab Emirates, and Fiji. The massive surge in infections, however, is not leading to a 10 times increase in deaths because Omicron is 90 to 99% less severe. Reported deaths in the last week remain constant at 6,500 per day. The lower severity of Omicron is due to the following three factors. First, the fraction of people with asymptomatic infection is up from 40% to 80 to 90%. Second, among those who have symptomatic infection, the hospitalization rate is down 40 to 60%. And third, among those hospitalized, the fraction requiring intubation and or dying is down 80 to 90%. Next slide, please. Hospitals will be under considerable stress because of increased admissions and from staff absences due to staff testing positive and having to quarantine. The hospital surge we estimate includes admissions that are incidental, namely individuals presenting at hospital for other issues and testing positive for COVID-19. There will also be pressure on hospitals from COVID-19 patients and staff shortages. The staff shortages can be ameliorated by testing only symptomatic individuals and reducing quarantine for those who test positive. Similar consideration should be taken to keep schools and essential businesses open in the next weeks, namely stopping testing of asymptomatic individuals. And that is what ICMR has adopted. Second, since Omicron transmission is so intense, efforts to impose new mask mandates or other social distance mandates should be avoided as they are unlikely to have any significant impact. Individuals who are vulnerable should be encouraged to protect themselves through high quality mask use and social distance. And third, to speed up the transition from a pandemic mindset to managing a recurring infectious disease in the future, surveillance efforts should be maintained after the Omicron wave. Vaccination, including boosters, should be encouraged, antiviral access enhanced or obtained, and vulnerable individuals encouraged to wear masks and social distance if and when the next wave comes. Next slide, please. This is the estimate percent of new infections that are Omicron variant. The Omicron variant has spread rapidly across the globe, and based on GSAID and various national databases combined with our variant spread model, it is estimated that it is now dominant in nearly all the countries. Next slide, please. This is the proportion of the population reporting always wearing a mask when leaving home on January 10, 2020. What does it show? A substantial population is not adhering to wearing masks. Mask use remains the most immediate and cost-effective way to protect individuals and communities from increasing transmission. However, only 55% of people self-report always wearing a mask when leaving home. That has to increase substantially. Next slide, please. This is the COVID-19 cases per 1 lakh population reported by the countries, and where you see the dark brown is the highest. And what you see, the entire North American component of portion of South America and major part of Europe is intensely reporting cases. Next slide, please. This is the COVID-19 deaths per 1 lakh population reported by the countries. And you see The darker blue is the most intense concentration of deaths. And you see, it is in Eastern Europe and part of Northern America. Next slide. Next slide. Geographic spread and prevalence of variants of concern. The current global epidemiology of SARS-CoV-2 is characterized by the emergence of Omicron variant, declining prevalence of the Delta variant, and very low levels circulation of Alpha, Beta, and Gamma variant. Following the identification of travel-related Omicron cases, many countries are now reporting clusters as well as community transmission of this variant of concern. Among the 357,206 sequences uploaded to GSAID with the specimen collected in the last 30 days, 280,000, that is 58.5% were Omicron, 41.4% were Delta, and less than 0.1% were Alpha, less than 0.1% were Gamma, and less than 0.1% were Beta, and 6 sequences comprised other circulating variants. To note, global variants of concern distribution should be interpreted with due consideration of surveillance limitations, including differences in sequence capacities and sampling strategies between countries, as well as delays in reporting. Next slide, please. This is the prevalence of variants of concern, Delta and Omicron in the last 30 days, and you can see how Omicron has spread across the world. Next slide, please. This is a summary of phenotypic impacts of variant of concern. To note is transmissibility, increased transmissibility is there in Delta and Omicron. Disease severity is possible, reduced risk of hospitalization and severe disease in Omicron. In Omicron, again, risk of reinfection is there. It is increased risk of reinfection, impact of diagnostics. PCR continues to detect Omicron. Impact on rapid antigen test is under investigation. Results are mixed as to whether or not there may be decreased sensitivity to detect Omicron. Next slide, please. This is the table, which is summary of vaccine performance against variants of concern. And you can see the AstraZeneca vaccine is effective in Omicron as well. So there is a continued use of effectiveness of AstraZeneca, which is Covishield, against symptomatic disease and neutralization. Next slide, please. Attention is the rarest and purest form of generosity. I'm grateful for your generosity as you've given your attention to the presentation today. Thank you so much.
Thank you, sir. Thanks for the wonderful presentation as usual. So for the want of time, we'll invite our guest speaker. After that, we can take all the questions together. So I invite Dr. Dhurjati Majumdar. Let me give a brief introduction of Dr. Majumdar. Dr. Majumdar has qualification of BSc and MSc in Physiology with specialization in Ergonomics and Work Physiology from University of Calcutta. His experience in understanding the industry dynamics started with his PhD thesis entitled Ergonomics, Occupational Health, Safety in Jute Industries in India. He worked as a research associate in the Industrial Management and Engineering Program at IIT Kanpur during 1985 and 86. He served as Assistant Director, Central Labour Institute, Mumbai, Government of India from 1986 to 1988. He has worked in the Defense Institute of Physiology and Allied Sciences, Defense Research, that is DRDO, under the Ministry of Defense, Government of India since 1988 as Scientist Director grade. He started the first 3D motion analysis laboratory in the country for experimenting on gait, kinematics, and EMG in relation to MMH activities. He has published series of papers on ergonomics in International Journal of Ergonomics and other peer-reviewed international and national journals. He is a reviewer of almost all the international journals in the area of ergonomics in the world. He runs his own consultancy named Ergosol since 2018. Sir, with that brief introduction, I welcome you, sir. And sir's topic today will be ergonomics in industries. Sir, the floor is yours. Please go on, sir.
Good evening, everybody. Let me share my slides first. I hope you can see it.
Yes, sir. We can see. Yeah.
You can see it, no?
Yes, sir. Yes, sir.
Dr. Guru Prasad, I hope I can speak around 40 minutes, 45 minutes. Hello? Dr. Guru Prasad, can I speak for 45 minutes?
Yeah,
okay.
35 minutes should be fine, sir, if you can speed up.
I'm trying my best.
Sure,
I have
sir.
already made some slides, but I will skip someone. I am extremely thankful to Dr. Rajiv Kumar Jain, and especially the Delhi chapter of Indian Association of Occupational Health, to invite me to share my knowledge and experience in area of industrial ergonomics. And after such a beautiful lecture of Dr. Jain, and everybody was attentive, an attention curve, it says it starts declining after 25 to 30 minutes. I do not know how much I will be able to tell you and share my experience with you. But everybody knows about what is ergonomics and human factors. But let's have some refreshing our memory and knowledge about what is ergonomics. Then I will take the help of some slides and to show you that some video that how ergonomics can be implemented and what are the different problems, mainly 3 areas: manual material handling, the posture, and the workplace layout. And then obviously the very high risk situation is the design and anthropotechnological issues, with the help of some of the videos and slides. As far as possible, I will try to be very short. But in the meantime, I may stop the videos also, because sometimes it is quite long. Okay, just because in the 35 or 40 minutes, it is not possible for me to take into account the ergonomics, the detailed, because that ergonomics has been increased leaps and bounds and has been maximally applied in defense, and then subsequently, obviously, in other areas like in the West, applied in industry, and other way it is also used in agriculture and the defense and other product development also. Let's start. That at the beginning of everything of our life is the user. And user, that is, it is the human, it is a man or a woman, and he is always encircled with a machine, task, and workspace. We all know. And there is not such an environment anywhere where we are not encompassed with our machine or our task or workspace. Even when we are sleeping, we are doing some kind of task, we are doing something, we are spending some energy. When we are dreaming also, it is that. And all these user and machine task or workspace, whatever may be, we are always encompassed within our environment. That is, the man-machine environment system is the ergonomics, that is the most important part. But the unity of this system, the comfort, the well-being, the safety, performance, and productivity on the entire system depends on how all the elements of this system, that is the user, machine or environment, user task or user workspace and environment, are compatible to each other or all as a whole. Either you have to be compatible immediately with your machine, or you have to be with your environment, or all should be compatible to each other. Then there should be a maximum comfort, well-being, safety, performance, and productivity. These are the 5 basic words which we always use in the occupational health, and particularly when we use the ergonomics in industry. Let's see some of the examples. That we all travel to the airports, and that how long the CISF, that very important issue, that how long the CISF people, I have taken in one burning example, they walk. Previously, if you have got an idea, latest when I traveled only a few months back, from my interview with CISF people, I came to know now they are working only 20 minutes per hour. And then they change again. They go, it is not that they take rest. Then they go sit in the X-ray machine or somewhere, but again they come back. And within 20 minutes time, they have to scan at least 100 travelers. And during this time, how many times he has to bend, how many times he has to bend his neck, bend his back, you can imagine very well. And mostly he stand in one leg. And we know all that most of the CIS people, they suffer from back pain and all musculoskeletal disorders. Simultaneously, if you look at those who are the operators who are running the extra machines, on whose attention, on whose perception, on whose vigilance the entire aircraft safety depends, how the workstation situation is there. He has no proper workstation there. You know, it is in a makeshift arrangement they are sitting. They have got no proper back raise. They are not a proper chair. They have no proper leg rooms and so on. And sometimes maybe in a hurry or something else, the person cannot sit properly for a long time. They can stand also and start working like that. So these are the problems of the workstations. These are the problem of our work environment, and these are the problems of the work per se. And within this system, the man is exposed. The women are exposed, and they are continuously be subjected to different kinds of risk factors. But simultaneously, you see these things, how the behavior affects the ergonomics, how we are affecting ourselves. You know, these electronic machines, you know, and why this yellow line is there. Everybody know that if you cross this yellow line, then this electronic gate starts malfunctioning. I should not say it is not functioning, but this malfunctioning. While these people are little bit aware about they should not, but why these people are standing? Do you think they are not educated? They do not know that they should not cross. But the very important thing is that they are less careful. They are unaware possibly that until unless the CISF people, he will check him, he will scan him, he cannot cross. But in spite of repeated repairs, if you go to any airport, you tell them, to the travelers, please go beyond the yellow line. You will definitely be boomeranged with thousands of abusive words. But as soon as you go and travel even in Singapore, nearby Mauritius, or in the US, Europe, you will find you cannot dare to cross this yellow line at all. So this is the behavior, and this is the environmental way. This is the way we are affecting our own environment and work. It is also the similar situation nowadays because everybody is doing in the work from home. I have taken this example because this is the classical example that where people are sitting and underneath their chair table, the work days, everything is there. So this person, he has got no proper work chair. He has not the proper work table. He has got no leg room. He has got no proper hand raise. His back is bent. He is a slouching posture, and everything is possible in any kind of work environment. And my intention is to show you this. You know, it is another example that where a man is using a forklift trap, and how to reduce this and reduce the stress level of this person is a very important issue in the industry. Although the number of people, the person working and running this forklift trap are less, but they are the most important person in improving the accident, improving the safety performance, because this is the most prone accident situation in any kind of environment. But these are there are, in my experience of seeing in the different industries, I have seen that very sophisticated system where the person can see everything in the video screen. He has not been installed in our country. Even on the best of the best warehouses, I have done some studies, and I find the very old forklift tracks are being used, and the person is subjected to all kinds of hazard in the accident prone situation. He is having back pain, neck pain, and whatnot. Then how this ergonomics is defined. Let's see how ergonomics is defined with little bit of background. How the ergonomics is defined, it says ergonomics is the science, it is a technology and art of man at work. Because ergonomics is a combination of many of the subjects. If you go to the internet, you will find thousands and one definition of ergonomics. But International Ergonomics Association, the IA, has defined it, that ergonomics is the scientific discipline concerned with the understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. It is a little bit of complicated definition, but let's see, there's another definition, and which is a very simple one, and which is very easy to digest. Ergonomics contribute to the design and evaluation of tasks, your job, your products, your environment, and systems, the overall systems, in order to make them compatible with the, very interestingly, in order to compatible with your needs, with your abilities, and your limitations of the people. Very interestingly, we have got no control most of the time of our need and greed. And we are not aware about what about our abilities also. But one should always know what are the limitations. If you know your limitations, then you will be very compatible with the system, because you can develop your strategy how to do it. So this is a very good definition, and I will show you 2 slides how you will understand that how compatibility is an important factor in our daily life. Say this is a tap. You know, in this tap, the lever goes behind and the water flows. You see it again. The lever goes behind and the water flows, and you have to put it front to close it. But there is another tap. This is coming, lever goes front and the water starts flowing. Again, you see it. So which one you would prefer in your work situation? There is no hard and fast rule. But what we always expect that it should be that when you move forward the lever, the water should come down. But this other design is also there. And very interestingly, my daughter, she stays in Bangalore in one of the very luxurious apartment, and we have seen she has got 2 sinks in her kitchen, and two sinks have 2 taps, and both the taps, those photographs and video I have shown, are entirely different. And mostly the other one, where lever goes back, people refuse to use it, or during use they do some mistakes. But in an industrial situation, even this kind of mismatch or incompatibility is there, it may cause any kind of accidental situation. So compatibility is very important. Next important issue is human limitations. As we know that we have got limitations of everything. Human body, even God could not make it more than 40% effective. We have got everything limited. Anthropometric limitations, we cannot reach beyond this. We have got biomechanical limitations, postural limitations, physiologic limitations, strength limitations, visual, audio, metabolic, and many more limitations are there. Therefore, while you are thinking about that ergonomics, it says it is the systematically fitting the job to the person instead of the person to the job, because a job can be designed, the machine can be designed at any dimensions, any capacities. It may be 400 times, 1,000 times. But during the Second World War, when ultimately the ergonomics started developing from the warfield, people came to know that machines were developing war machines, like anything in the factories being developed in the Europe and US and other countries. But human, the soldier, could not use it. Even 40% use was very difficult for them. Then people started that there should be a multi-scientific group which can take care about the problem of the man in relation to this machine and environment. And they ultimately clarified that it is the systematically fitting the job to the person instead of the person to the job is the whole criteria should be. But in the industries, you know, if you go in the higher level, senior level, executive level, this thing is applicable, this thing is being done. But in our country and all developing countries, it is a very difficult proposition in the lower level, and in the particularly the workers. Anyhow, it says that ergonomics is the fitting the task to the person, or use the rule of work, or work harder, not smarter, and make things user-friendly. It can be. But if you go through these few 5 words, who, what, how, when, and the goal, then you can very well define with this only slide what is ergonomics. You know, ergonomics can take into account the human population, and for that it can be the system, it can be by any one of these engineering, designing, applying, studying, and optimizing, or you can work for anyone, the environment, work, and safety, or for the people, or you narrow it down further toward the user or to a particular person concerned. And there you can do the system, you can use for the people particular machine, users using any equipment or the product, and person is the product and technology. Very interestingly, you can use any one of the thing, engineering, decision, designing, applying, studying, and optimizing in any kind of environment, in kind of work situation and your daily life. But my goal is again, the 3 words or the 5 words: safety, comfort, efficiency, well-being, and productivity. These are the very important issues. So with these simple slides, you can understand and how this is very, very important in the daily efficiency and productivity in industry. Very interestingly, the ergonomics has been developed and is composed of various sciences: human science, medicine, psychology, sociology, pedagogy, engineering sciences, physics, construction, measurement, economic, and social sciences. They develop like to ergonomics. Everybody can contribute something so that you can take into account in a multi-scientific value. That's why we call it is a science, technology, and art of man at work. But ergonomics has got 2 very important issues that one should be very careful while utilizing it and applying in ergonomics. It seems it is a very simple thing for applying ergonomics in industry or apply ergonomics in any kind of environment. You ask anybody, any Tom, Dick, and Harry, they will say, oh, ergonomics, I know it is very easy. But while you will be applying it, and if you, then you will find the real problem, how difficult it is. I will tell you this. But very importantly, you should be very careful. Either you are taking about at the macro ergonomics in the bigger level, or a micro ergonomics in a smaller level, but at a pinpointed level. Let us discuss a little bit about, let us know something about how ergonomics has been developed. Ergonomics is driven by various requirements from users, markets, industries, organizations, and government per se. And how ergonomics is developed till 1950s. First, it started from the military ergonomics. They started using ergonomics for designing their product and their machines. But subsequently, it has been taken up by industries. Then 1970s sees a big jump of consumer product design. Then 1980s is the human-computer interaction of the software designing. 1990s, the era of decades is the cognitive and organization ergonomics. But 2000 decades, the century of 21 onwards, it starts that design, global communication, internet, virtual reality, simulation, modeling, artificial intelligence, virtual collaboration, and ergonomics for multilingual, multicultural, multi-ethnic working groups. And this is very important for our country, the multilingual, multicultural, and multi-ethnic working groups. India is the only country where more than 987 languages are spoken, and there are 22 official languages in the world UN office. And that has been reflected by 17 languages in our currency that you must be knowing. This is the development of ergonomics era, but it is not that industrial ergonomics has started in 1960s, but it is a concurrent situation is going on. And these days ergonomics is used, all the branches of ergonomics is used extensively and mostly in industry, in everyday production, either it is an augmented reality or a virtual reality or artificial intelligence, everything to increase the productivity and the efficiency of its worker. Very interestingly, what are the different branches of ergonomics? One is the physical ergonomics, which takes into account the physical aspect, energy expenditure, your posture, manual material handling, repetitive movements, musculoskeletal disorder, workplace layout, safety, accident prevention, and health. Subsequently, the cognitive ergonomics, mental processes, your perception, memory, reasoning, motor responses, your attention, and everything. And these two are very interrelated, physical and cognitive ergonomics. A person can be physically unfit, but if he is mentally fit, he can do anything. A soldier who dies in front of an enemy bullet because he is mentally fit, he knows that even for the country, he is dying. So it is a mental issues that is a very important in industrial environment. Then the third, but not the third one in sequence, but it is one of the important thing is the organization of ergonomics. And it takes into account the organizational structure, policies and process. If the organization ergonomics is weak in any one of the industries, then neither physical, not cognitive ergonomics, not the office ergonomics, that is our effects of furniture, layout, and prevention, it will fail. But very importantly these days, which is which is being developed like anything everywhere, almost all of the IITs, NITs, and everywhere, there is the design ergonomics is a very important issue. The design at Center for Ergonomics and Design, they are working together to develop the products. Anything and everything should be human design, so that it should be, the user interface should be very, very friendly, so that a person can use it very easily and very human friendly. So let's look at it, that ergonomic risk factors, that means interact in three areas. One is the risk factors inherent in the worker, that is in industry, that we know. And mostly in industrial situation, we have got very little control, because what he is bringing, his physical, psychological, and non-work related activities may present a unique risk factor. Those who are attached to the industries, they know very well that a worker can bring anything and all the aspect in the work environment, and they can create a problem. But what the control we have got, we can apply ergonomics. Most importantly is the risk factors inherent in the job. That is the work procedures, that is the equipment, the workstation design may introduce the risk factors, and that we can design. We can make it more comfortable to the workforce that we have got. And not the least, but another important thing is the risk factors inherent in the environment. Some of the environments we create in the industry, an industrial environment is process oriented. So we can see that how the process should not take into account, should not put the workers at risk. So the physical and psychological climate may introduce a risk factors, and it is the urgent requirement of the industry to take into account of the ergonomic evaluation, so that all these factors can be taken into account, and this productivity and performance of the whole system can increase. But instead of going into the personal factors, work factors, and that, there are certain ergonomic factors which have been identified globally. I have listed only a few of them. One of the most important is the posture, awkward and static posture, hands above shoulder level posture, fixity, prolonged static posture, and the force application, where it is related to manual material handling, or it is a contact stress and vibration, or it is weight of the load, or workstation layout, force of movement, repetitiveness, how it can be avoided, how these all ergonomic factors should be avoided, so that the workers become more comfortable. But most importantly, what is not very looked into most of the industries is inadequate rest and recovery. Even the person who is doing the manual material handling, or who is involved with the awkward posture and all, he gets the same amount of lunch and tea break as other administrative staff workers also. And that is the practice is being followed in most of the industries. So let's have some of the issues about, one of the important issues is manual material handling. Okay. Now see, I will show you. So this is one of the example of a manual material handling, how in the pharmaceutical industry. One way, when we are thinking about the wearing a manual personal protective equipment, the doctors, nurses, and healthcare workers, they're all being done, and they are giving their life for doing this thing. But in pharmaceutical industries, if you go, so most of the people, as soon as they enter into the factory premises, they are wearing throughout the shift this personal protective equipment. And wearing the personal protective equipment and working is a very, very tough job. In spite of the environment is very comfortable there, but you start sweating like anything, and 8 hours of sweating. But the very interesting part is there that this kind of operations they are doing, and this kind of bending and taking the raw materials from the chute, that we know these are all. And simultaneously, if you look at it, that there are several issues are involved here in any kind of manual material handling. It is simply not related a very heavy job, but here the posture, here is the bending and how he is doing. All the biomechanics issues, the physiological, psychological, and the biomechanical issues are very, very important. So let's have a look in the second slide. So say another one. So this is a classical example, what we can see it, that people are walking, extending their hands, and they are putting the load into the conveyor belts and so and so. And somehow this kind of activities can be avoided by simply using some of the ergonomics methodologies and ergonomic tools, or very interestingly, this kind of manual material handling can be avoided by using the simple method where the load will automatically be loaded in the conveyor belt. But that kind of activities are missing in our system. Another system is, although we say that manual material handling and heavy load handling is not being done in India that much in the industries, but it is not true. But what happens, whenever this kind of load handling works are there in the industries, we simply give it to the casual workers. We simply outsource this to outsiders and they do it. And you cannot imagine that these kind of workers, even for a daily 400 to 500 rupees, they handle more than thousands of kgs of load. Similarly, in the wagon loading, the same situation is being practiced everywhere. And this unorganized sector, those who are involved in the organized industrial situation, it is a very peculiar phenomenon. They are not under control of any kind of factories, rules and laws and anything. But whenever they fall sick, they go to the health sector, they come to the hospitals, and ultimately it is a burden, not only for the hospital, ultimately it is a burden for the government. Other countries in Europe and American countries, they have implemented ergonomics in such a way so that they do not fall sick, so that ultimately they come to the hospital and all medicines and treatment has to be borne by the government, and ultimately it is a government burden. It is a taxpayer's burden to all of us. So, but this is going on in India. One of the classical example is in one of the pharmaceutical industry. This is the ampule vials, injection vials, and it is being loaded by one person. He is bending and he is giving it from here, extending his hand and giving it and here. My humble submission was there when I have told them that why can't you, when this is coming from the incubator, the whole load of ampules, why cannot this tray can also be put in the similar height? They said, oh, I did not notice this. We are practicing in the last 40 years and nobody has told us that this is the way we can avoid the bending of the individual workers. And one of them, because of the bending 1,000 times daily, he has undergone a spinal surgery too. But nobody noticed that there can be a simple solution of ergonomics. With that, this whole bending can be stopped. Another example is that this is very good examples, and whenever I go, I show this thing. This person is a loader. He is putting some fuel material into the blast furnaces, because steam generation is a very important issue in the industry. Steam has to be there for many, many operations. But while he is doing that, his hands are extended like an albatross. This work is outsourced to a casual workers. But the very important part is there that he is with minimal safety gear and he is doing manual material handling. His biomechanics is it's very noticeable. He is exposed to an environmental heat. It is a 700 to 800 degree temperature he has been exposed, and simultaneously the kind of load he is handling. But he works for 4 to 5 hours there, and the time and the during working, I have noticed his heart rate shoots up to 180 to 190 degrees centigrade. So he is exposed to extreme heat. He is exposed to extreme load. He is exposed to extreme bending. He is exposed to all sorts of activities. Okay, but simply using of the ergonomic principles, simply you can very well take care of you can make their work more comfortable. Very interestingly, not much recommendations are there. factories laws and rules are also very vague about what should be the manual material handling operations. There is no lifting load until unless we use that NIOSH lifting equation, which is also not valid for our country population. But there are some suggestions for the Indian populations by Jain et al., Nag et al., Saha et al., and all. But what should be the load? When we can consider it is a moderately heavy, very heavy, and extremely heavy. But I am sure, I doubt this work organization system in India has been followed based on the classical example or classical recommendations of the Indian scientists working on the Indian populations. But if we can do it, because then they will be more comfortable, they will be more beneficial. So next, see that posture and workspace design, how it affects. I will be little bit faster. You know, this is one of the classical example. It is a drawing boards of a draftsman. These draftsman activities have gone because almost gone since the computer has taken care of everything. But very interestingly, the same draftsman, it is only 10 posture is being shown. And this is there in the ergonomics textbook. We know that which posture is correct, we do not know. Nobody can say, because everybody says in their own posture, I am comfortable there. I have got no issues. But what kind of in terms of occupational health or in terms of ergonomics, we can say the posture 10, posture 8, posture 7, posture 5 are not good. But which one should be good and which one should be bad, it is a different issue. But we know that poor posture can lead to all sorts of back pain, neck pain, shoulder pain, and everything. And it simultaneously, it can lead to workplace stress, repetitive strain injuries, lost time, reduced productivity, low morale, and higher cost. Okay, but let's see that, and these postural issues we have faced extremely, and we are facing now by our working population while working from home. All sorts of postures are there. And I have developed hundreds of lectures from what should be the ergonomic should be followed during work posture home. I don't know whether people are benefited or not, but because these are really issues, because posture is the biggest issue. If you go to the industries, you will find very interesting thing. People are using 1, 2, simultaneously 3, 4 terminals, terminals and the computer terminals, and he's sitting about 4 feet away. He has got no proper work desk. He has got no leg room. They say there is no leg room. Mostly he sits with the cross-legged, which should not be there. Or he sits in such a way because he cannot go inside because of the old computer keyboard, so that he keeps his computer there because the desk is not very wide enough. He sits and turns his neck this way. Or for the working population, especially in Indian environment, none of the work desk side, even the chair, which should be minimum 15.5, 15.6 inch, or it should be 15 inch, is not at all designed, except a few of the chairs, which is very high-end chairs. Otherwise, most of the women workers, even the administrative workers or IT sectors, while they are sitting, it is not properly designed. Either their foot is hanging, or there is a total compression of their thigh. The people, when they are using with the laptop aids, they are sitting in a bent posture or so. We can go in the industries, the women are working like anything, but most of the time they are sitting in a stool, in a steel chair, which is not properly, their leg has been hanging, or their posture is not proper. They are taking care of different types of awkward postures. In pharmaceutical industry, the situation of these workers are really very, very bad, because all the most critical operations and the inspection operations are being done, and even the administrative works are being done by the women workers, and you can see the situation there. There is no proper work days for them. We work for them. Okay, one of the classical example is there, that is that how that machine and man is not matching properly. So this is I am not taking the name of the particular industries because secrecy. You know, this is a machine where a man is sitting and continuously is a conveyor belt is running and continuously, you know, capsules are going, and he has to check because there is a light and there is a transparent screen glass. But what is the situation? This whole system he has to sit because this chair has also function, and this has come from a European country. But what happens, you know, he has to sit in this posture. He has got no leg room, he has got no thigh room, and he has to continuously place this with his left ankle, so that it is a foot switch, so that the conveyor belt can run. This one is winged elbow. He has neck is bent. He could not take the backrest properly. So all these issues are there, and one has to be taken care of these issues. One of the example I tell you in the through video, this lady is just folding and making some boxes. It seems that she is working, she has got, this work is very light, but her biomechanical stresses and the ergonomics risk factors are very high because she cannot sit properly. This is not a proper workstations. But she is working, not only one, many of such ladies are working in the industries in that kind of a situation for 8 hours of the day, days together, 24/7 and 365 days. So they are increasing the load, the injury risk load to the industries, and to the number of absenteeism also increases and whatnot. Another example I tell you that I have told you that ergonomic risk factors, the repetitive, the contact forces, the bend posture, and you can see with this slides that how 3 persons are working and in such a way that they are all repetitive phenomenon and all are present here. Let's see how they do it. So let's start with this person. He is feeding something from here. He is taking it here. He is the manager seat here. He has got no sitting table itself, no backrest, and this person is ultimately loading it here. Okay, you see, can you see his posture? You can see his posture and how fast he is. He has to operate. So it is a classical example of all the ergonomic factors, starting from repetitiveness to motion to awkward postures and everything. And very important thing is, all of them, when I ask them, including this person, he's supposed to be replaced one of them after 2 hours or 3 hours, all of them having their neck pain, their back pain, even in thigh and leg pain. So ergonomics has gotten tremendous applications in industry. I have worked extensively with my laboratory scientists in the nursing population in Indian Army and Air Force bases. And we have found that their basic activities of the time spent is patient care is this much in morning, day and night, which is the maximum, and administration is that, and least is night shift. But very interestingly, while we have seen that while standing in the morning is this much and is this much, but total walking period, they walk around brisk walk is this many kilometer, and the maximum is the day shift, which is also an extended shift in case of Indian Army. But very interestingly, we have all noted the health disorders and all. In some other time, I can show you this slide. But why I want to show you this thing, that almost 6%, the Chinese paper says the Chinese nurses, more than 78% of the Chinese nurses also suffer from the musculoskeletal disorder, and mainly low back pain. It is followed by neck pain, ankle, foot and all. It is a silent killer of a person. This is the musculoskeletal disorder. It can make a person cripple. It can make a person total fatigue, and she cannot work. She can start reducing. She cannot give when you have got a chronic back pain or low back pain or upper back pain or knee pain, continuously cannot produce. The last one is the design and anthropotechnological issues and how this is effective, although there are other factors also, because we know that human body is extremely variable system. It varies like anything. I give you a simple example. in the in DRDO, in our lab, DPAS, we have got more than say 100,000 soldiers data. And when we have analyzed, we have distributed them in the different groups, we found how the Indian, because it is a multi-ethnic, multilingual country, and doing ergonomics in India is an extremely challenging thing. Why? If you see the Gorkha soldier who is 5th percentile, his height is only say 155 centimeter, but a Sikh Punjabi with a 95th percentile is tall, his height is about 185. So that is a difference of about 30 centimeter, which is equivalent to an 1 feet. Simultaneously, their weight also, you can see there is a difference of more than 30 kilo. How difficult it is, can you imagine when you are designing a tanked seat? This, I have encountered this thing in my whole life, that how to design something which can be utilized by a Gorkha soldier and a Sikh soldiers also. Okay, it is a very, very tough job. And the similar situation is occurring in our industries also, in our industries also, because there is a mixture of population, mixture of workers from all different types of states are there. Now I will show you, say one of the examples, say they are filling some of the chemicals in the bag. You know, 2 persons are standing and they are standing. This is a design issues. The machine is not designed properly. He has to stand continuously and operate it. So what happened? A worker this way, he fills about 6,000 bags per shift to collect empty bags from his right side. He simultaneously blends laterally, turns his head right, and bends his neck down to see the bag for about same number of times. That is 6,000 times he bends, he turns his neck, and this operation is highly hazardous, involves significant risk of developing musculoskeletal disorders, and he moves both his hands from natural hanging position at mid height to the head height, and for the same number of times to put the bag in the bird's beak. He has to put it here, and then automatically the filling will start from here. And for sack gripping about 600 times. These are repetitive operations and hazardous, and he remains standing throughout the day. And you can see also the workspace is also not very clean. So how it can, you can see it properly. This person is actually, he is stitching, and while stitching, he cannot move his left leg because it is fixed here, because if he presses this button, then only the stitching machine will operate. Or not only that whole conveyor will start operating based on how he presses this one. So the operation of the whole conveyor system of several workers depends on how this person is fitting. You can imagine the situation. Why not we can change it into an hand operation? Why not we can change it into an timely operation system? Why not we can change it into the double pedal system so that he can use both the legs simultaneously? And also you can see that how this person bends continuously one after another. So the situation is that you can see sometimes a person has to operate 2 machines together. You know, total number of backfilling remains the same, but his walking and his bending increases tremendously. So this is the way. So how it can be solved? We applied ergonomics in a very simple way, that he's, instead of bending, because his this bale, that empty bags were keeping in a 16-inch high stool, iron stool. And every time they were keeping only one bale, which was bringing it into the 22-inch height, 16 plus another 6 to 7 inch. So adding 3 bales on low stand height, 18 inch, increases the accessibility of the empty bag and minimize the lateral bending significantly. They were asked not to sit down while collecting the bag. It is again the training. After few trials, they could easily collect empty bags without bending his body, head and neck. Appropriate electronic devices must be installed for bag grip operation so that bag gripping also can be done. I will show you that how this has been improved. You know, if you do this thing and if you can train the work properly, it is the aspects of occupational health. You have to apply the simple ergonomics. You need not to use the very sophisticated technology or so, but somehow you can make their life more comfortable. Only thing is that somebody is there, he has to refill the stack in an appropriate height so that it should be at his waist height level. You know, I want to show you this slide for an important reason. You know, they have got, this factory has got another very soft, this is the thing I was showing the video, these are old, but this is the new machines have come. Here where people are very comfortable, it is more little bit comfortable. This height is also, the environment is clean, and this height of the stand is also a little bit higher than the previous one. And they are using few bales together so that he need not to bend. Sufficient space between bagging and stitching machines, control panel and obstruction, body hand movement are also less. But one thing is not there. If anybody has noticed, is not, this is the situation. They are not using any helmet, no safety shoes, no personal protective equipment. None of them they are using. But the factory's laws, but that factory's law itself says that they have to operate it. They have to operate this machine with this thing. You know, previous machines they are using it. As soon as the new machine has come, the risk level remains the same. Only that aesthetic has changed, but this thing has totally gone. The question comes again, where is the supervisory? Supervision is less. Is it so? Or it is the behavior of the workers? Next is another operation that is this is last few slides. One is that anthropotechnological issues. We worked from Argosol in factory. They are manufacturing one of the seal. You know, we found that actually they came to us that many of their workers, they are leaving this hydraulic press machine operation because they are developing very quickly within 6 months, intense back pain and neck pain, they cannot operate. But we have seen that whenever a person is working in any one of the hydraulic press machine, he cannot stand properly. He has to operate standing laterally with the machine. This is the person. And because of that, he has to bend his neck. His craniovertebral angle is too much. His bent neck is also too much. You can see this is the operation. And the work height was quite low. The work height of these machines, this machine it has come from abroad. You know, it is a technology, we are bringing it without considering the anthropology of our body. So you call it as an anthropotechnological issues. You know, this is a very important issues. You can see this, his neck bend and his back bend, but it is very difficult for him to operate standing properly because the work height is less. But this is not the issue. The thing is, then he cannot stand properly, and whenever he wants to stand properly, on the lateral way, his feet is like that, and this lower portion is touching the portion of the body, and it is the lathe machine, that hydraulic press machine platform. Then the second thing is also that he is operating mostly on the shoulder height or the upper height. And the space between where the hydraulic press machine is there and there is a railing, the space is quite less. It is not even 2 feet. So we observed ultimately that what is the problem? Why they are bending continuously and repeatedly during the entire operation? Because we find that somehow while establishing this machine without any knowledge about that, this person has to put his feet properly. So this is, if this is the lathe machine platform, there is the hydraulic press machine platform. So the person has to be there, but there is a gap between this and this safety gird. It is about 6 to 8 inch. And this 6 to 8 inch has been installed, it has come from there in the abroad as a safety gear so that they should not fall. But instead, why it is here? Why can't it be here at the halfway so that his feet can go inside? And this is the way when we can see that while operating also a person, he bends like anything. In the other smaller hydraulic press machine, the safety guard is also quite bigger in dimension. What happens as a result? That this person cannot reach to the workplace, and he has to suffer a lot. So therefore, the ergonomics has to be taken care of. The most important issue these days, we have to develop our own product based on our own database, based on our own population. As an ergonomics, what we feel the lacune is there, that what is known and what is put into practice. There is an islands of excellence in India, but there is oceans of deprivation. Use of leading edge technologies and the conventional ones are continuously being run in our countries, in our industries. There is a problem of organized sector economy and organized sectors of backwardness. Recognition of ergonomics is externally we are giving, and feeling of ineffectiveness locally because people are not willing to do it. They think it is a very costly affair, and or it will reveal their drawbacks. Communicating the influencer and the public is a very important issue. The education, awareness, and attitude, that is the three most important issues what we feel that it should be taken care of. Our workers, ourselves should be educated, aware, and attitude should be there for the proper and occupational health attitude. Their awareness that what is their right, and they should be educated properly. They should be trained properly so that they can work properly, and ergonomics we can apply for everyone. So this is a challenge of ergonomics. It is somewhere in the sub-Saharan desert. Nobody knew that how this machine was, how this track was developed for how many kilos, but they are using it like that. And when I have shown these slides to international ergonomics community in my last keynote lectures, nobody knew that how this track is actually running. So thank you very much for your patience hearing.
Thank you, sir. Thank you, Dr. Majumdar. It was a very informative talk. Thanks. And now we'll open the forum for questions. Of course, we have overshoot for 10 minutes, but it was really worth every minute of it because we had two very good lectures by Dr. Majumdar and also Dr. Rajiv Jain. So let us open the questions. And one question we have already from Dr. Govind Narke. Sir, this is to Dr. Majumdar. Prolonged sitting is a major issue. Any practical solutions?
And the answer is, I tell you again, the answer is, it is the work from home that is the same issues. What we say that, you know, there are some formulas there. Now it says 20, 20, 20, 30, 30, 30. Whatever may be the situation, you get up everywhere. You get up. Don't work continuously as long as your body is giving so that you can sit continuously for 20 minutes or 2 hours. Never do it. Every 20 minutes, every 30 minutes at least, you get up from your chair, move around, see some greenery, do some micro exercise. You know, we call it a stretch break. Sitting on your chair and table, if you cannot get up, turn your body. You know, you can do some kind of, any kind of exercise. Thousands of exercises are available. Don't sit continuously, always get up. Whosoever is there, whosoever tells you anything, don't sit continuously because it causes problem. Whether you are using a computer or you are doing any kind of administrative work, you should have a proper work surface. You should have a proper workstation. You should see your feet is touching the floor and there is enough leg room, and you should get up and you should have a backrest and your spine should be S-shaped. As long as you can maintain this, you will have no problem. Thank you, sir.
So one question from my side, is it the foot support should be there to reduce the pressure on the thighs?
Yes, it should be. But the thing is, well, many people, they use footrest. My advice is don't use a footrest. Try to avoid footrest because a footrest is again restricts your leg mobility. You should see there your chair height is so adjusted that your knee, that it should be a 90-degree angle at least when you are sitting and your feet is touching properly, rested on the floor. If you can rest it on the floor, and if you have got sufficient leg room, then you can use your leg properly, and your thigh compression will also be reduced like anything. That is the suggestion, sir.
Okay, for the panelists, any questions for Dr. Jain and Dr. Majumdar? Dr. Kamala Fatyal, Kishore Parekh, Dr. Manswami Tyagaraja. Any questions from your end? You can unmute yourself and ask the question, sir.
Yes, sir. Hello.
Yeah, Dr. Kishore Parekh. Yeah.
Sir.
Yeah. Sir, Majumdar sir, what include the basic ergonomics, sir? Because in industry, usually we talk about the basic ergonomics to make people aware.
Yeah,
So what is basic ergonomics, sir?
Basic ergonomics means, as I told you, they should know the kind of say a worker is attached to a particular machine, say a particular machine. He should know the functionality of this machine properly. He should know whether he has got proper workspace or not. He should have the space. He should not unnecessarily bend, and he should be trained properly. Many of the times the workers, they adopt their own method, which causes their main problem. So this is become a disease condition. That is the thing he should know. I tell you one thing. Recently, I have done a survey on an important embassy in Delhi. They were having a work desk and which is a table, which is a height adjustable. One table cost not less than 2 lakhs in India. But while I went, I found they do not know actually how to adjust their height. And what should be the adjust height, at which height he should work. This is one of the example of that is the ergonomics, basic ergonomics.
Okay, thank you.
Thank you, sir. We have a question from Dr. Rajiv Jain. His raised hands.
Yes. First of all, I just appreciate the way Dr. Majumdar has simplified very comprehensively subject of ergonomics in industries. One question, or I have an insight in a subject which you mentioned in your slide of evolution of ergonomics, the application of artificial intelligence in ergonomics in the industry specifically. Any examples you could cite, or you can show us where artificial intelligence has helped performance of workers in the industries?
It is mainly used in the IT sector industries, sir. And I can give you an example, but now my slides are not on there. It is inbuilt in the system, in the software industries particularly. So that's why, and also where you can see, there is a big control panel display system where a person is subjected to enormous number of data processing and information processing. He's seeing in a control panel system in anywhere. See, railway control system also, if you can see, the metro railway construction system, metro railway panel system, there the artificial intelligence has been used extensively in reducing the load, and the machine is taking the load. Only minimum load is being transmitted to the operator. Otherwise, it would have been very difficult for him to cope up with the situation with his cognitive load. It is actually working to reduce your cognitive load and improving your awareness and attention. That is the example, sir.
Thank you. Another question is relating to participative ergonomics.
Yes,
like the methodology for engaging the workers.
Yes, yes. Participatory ergonomics, we always talk about it. It is a management technology. It is an organization ergonomics principle that it says that in the policy decision when should be there, the workers should be taken into account. The workers' views should be taken into account because they actually know what are the risk factors and where they are lacking, what is their problem. But as far as, but most of the industries, in India, except a few of the very upcoming or very well-developed industries, but hardly, they pass this information, workers to the supervisor, ultimately supervisor to next level. How much is the information is ultimately going, it is not known. But to our knowledge, the Japan has used that participatory ergonomics like anything in their country. When I give you a very simple example, when they introduced the 8-hour shift, and Japan women workers are working like anything. It is a story of 20 years back. They found that number of divorce cases has increased like anything in Japan. Then they think that how it can be reduced. Then with a participatory ergonomics application, they found that they reduced it into the 4-hour shift. So they will work from 8 to 12 or 10 to 2, and the buses will come, they will take their home. At least they can spend some time with their spouse so that the number can be reduced like that. participatory ergonomics has been used in India, particularly in the agricultural sector, and the home science scientists, they are using it and going into the field. They are taking into account what are their problems, because every soil, every field has got different issues, and it is related to their home also, because 85% of the workforce in agriculture is women workers. Their participatory ergonomics is being used even in India in a very bigger way.
Thank you for a wealth of knowledge. Thank you,
sir.
Thank you, sir. So,
Yes.
Dr. Tyagaraja, you have a question, I believe. Okay, so we'll go with the attendees. I'll be unmuting all. So if you have any questions, anybody, please raise your hand and you can ask your question.
Yes, sir. There is one question.
Yeah, please go ahead, sir.
Hello. Sir, Majumdar, sir.
Sir.
See, in many industries, it is very difficult to minimize the ergonomics problem, particularly the engineering measures. So,
no, sir, no. It is not.
Sir. So what they are doing, they advise some warm-up exercises and physiotherapy. So can you please highlight on this?
Sir, that is the biggest issue we are facing now in ergonomics in India. In India, because with due regards to the physiotherapists, those who are practicing ergonomics, in the name of ergonomics, they go to the industries, or industry, they take their help, who, if you are a doctor, what you will do? You will try to kill the, so we try to kill the Omicron, we try to kill the Delta virus, not outside, or not the external therapy. So exercise or other kind of thing is a secondary, it is a tertiary system. But you have to see where is the problem. I have shown you some of the video, that where is the problem. If you can do, and in any industry, there cannot be 1,000 types of machines, 1,000 types of operations, limited machines, limited procedure. If you do it real ergonomics, those who are ergonomics, I go to the industry, I say, see, this is your problem, and here you have to do it. And for that, you need not to spend a lot of money. The second, once you develop some kind of issues, then you go for again. If you have developed in low back pain, but why low back pain has developed, that you don't solve first. If you keep on doing bending, if you keep on adopting, if you continuously functioning in a bent posture or a bent neck, you cannot be rectified by any kind of exercise or whatever it may be. It can be a tertiary phenomenon, but the first and last thing is ergonomics is you have to find the fault and give medicine there, solve it there. Okay, sir. Thank you very much.
Okay, thank you, sir.
Thank you, sir. Dr. Tyagaraja. Please unmute, sir. Dr. Tyagaraja, you have to unmute.
Anything, sir, Dr. Guru Prasad?
Yes, sir. Dr. Tyagaraja wants to ask a question. Sir, please unmute yourself, sir. Yeah, please go ahead. Yeah, I can hear you.
Good evening, Dr. Guru Prasad.
Sir,
yeah, we can hear you, sir. Please go ahead.
Okay, sir, I am an orthopedic surgeon, practicing orthopedic surgeon, retired from Bharat Electronics.
Sir,
and I'm just, it's a very good lecture. Everything what we have come to know is one of the best lectures which
Thank
we
you
have
very
come.
much. Thank you very much.
And sir, see, especially when in an OPD or a practice or no, suppose if the patient comes to us, if they complain backache, what we will do is we will straight away we will examine, clinically examine. We will not think of the industry, why this man has come, all these things. I think there should be certain methodology in the industry. Just like when we are building an house, we are consulting an architecture. So like that, when we start doing this hangers or big hangers to manufacture radars and all, we should need a ergonomic specialist so that he can advise us how to do, how best to do, because long healthy life of a employee is more required nowadays rather than all these things. So, what do you, how do you highlight, sir, in countries like ours? We may be having orthopedic surgeon, we may be having physician or anything in an hospital, but the ergonomically trained specialists are not available. And due to that, we are facing lot of problems. Even ladies. And second thing is, one more I want to bring it, sir. So many people are not happy with the work which they do, because most of them are not getting this, what do you say, stability is too much nowadays in the youngsters. And they go for artificial insemination, so many things. And earlier days, we were not facing this kind of problem. And can you throw some light on this one, sir, regarding the ergonomics point?
The second part, can you say again, sir, that workers are not happy? Why?
See, they do continuously 12 hours and 14 hours work sitting at them, because there is a tension, you know. Nowadays, if they don't do work for a long time, they may be asked to get out. Or they may be transferred, they may be asked to get out. And because people nowadays, you know, they buy car, they buy houses, so many things. And there will be a lot of work pressure will be there, lot of work pressure. And due to that, their family, they are not happy with their spouses. I mean, that martial life is will not
sir.
be so good.
Sir, you have raised the questions, and answer is there only in your questions itself. The answer is also there. They want car, they want all luxury in the life, and they naturally, if the companies they hire them with such a huge amount, they will always ask them 10 to 12 hours in 14 hours of work. And this is the competition is so high, sir. It is not only here, it is in the throughout the global scenario. If you work hard, they will definitely reward you. If you don't do it, it is a very difficult situation. Okay, sir. And that's why ergonomics says that, but ergonomics doesn't say that you don't work. You work, but work comfortably, work leisurely. But the stress level these days is too high, sir. And for that also, lot of other extra exercise and all external exercise that is also there. You can say. So it is again the individual work oriented, what you should do and what you should not do. But again, I am suggesting you that as an orthopedic surgeon, as you have seen the patient come, and the patient, they have got low back pain or the spinal surgeries on all they undergo. But the thing is that the problem is that until unless he goes back to work and he sees that where is the problem. What happens, sir, in our country, most of the equipment, even today, we could not produce a good blood pressure measuring instrument in our country. You know, the products all are not related to the anthropometric dimensions of our body. And that causes a big issue. That is the anthropotechnological issue. That causes a problem of our posture. But that can also be customized as per of the workers in a particular industry. But that is not being done because there is again an industrial apathy towards application of ergonomics in their daily life. They consider that if you apply ergonomics, it may reveal some of the problem of our work ethics or work culture and so, but that is not there. And they think secondarily that it will be a very big issue for cost benefit in terms of cost benefit analysis, but it is not there. But what you have suggested, yes, ergonomics should be implemented there, but ergonomics is coming these days, sir. All IITs, all NITs, all engineering colleges, most of the engineering colleges, they are applying, taking ergonomics, giving ergonomic courses, and it is being included in the product design and everything. That much I can say, sir.
Thank you, sir. Thank you very much.
Thank you, sir. Next, we have Dr. Shubhendu Mudgal. Dr. Shubhendu, can you unmute yourself? Yeah, please go ahead.
Am I audible?
Yeah, you're audible.
Yes, sir.
Please go ahead.
Thanks to Dr. Majumdar for an excellent session. And I agree that many of the problems that you have highlighted are very, very much there in the industry, especially the clean industries like pharmaceuticals and all, where all the operations within the system is fine, but when it comes to the loading, unloading, and packaging department, all the ergonomic stresses, they do occur. Because the systems, the contractual work is not taken into consideration. So that is, I think, is a very big area, the supply chain and the contract work where the ergonomic stress is very high, I would like to say. What is your opinion, sir?
It is true, as I mentioned, that organized sector and unorganized sector, they are working together. And recently I went to another very big fertilizer industries. I found more than 60% staff are actually unorganized, they are contractual workers. And if they are doing any kind of ergonomics is a big issue for whom you are doing, and why the industry says that why we should spend for them. They are not our headache. But ultimately, when they fall sick, that becomes a problem for the country. It is a government suffers. It is the hospitals and the doctors, they suffer ultimately. So, sir, like occupational health, ergonomics also not being taken care of by government of India as such a way. Whatever we tried, but it is least accepted possibly. But people know, all industries, all agricultural field and everywhere, they know the application of ergonomics, but they are somehow kept it as a last resort type of thing. That is the thing. But those who are using it, they are very successful in their productivity and all.
Yes, sir, you're right. And actually the impact is seen in the health sector. The nursing staff is having the maximum prevalence of the low backache and the absenteeism also.
Sir, yes.
Yeah. Thank you.
Thank you, sir. I think we don't have any more questions. And of course, we have overshoot by 30 minutes, but it was a wonderful lectures by both the our speakers. Dr. Rajiv Jain, wonderful epidemiology, covered all the national and international aspects, and Dr. Majumdar covered all the ergonomics. Of course, sir, Dr. Majumdar, we have a lot of questions to you, but one of time credit, and they'll be contacting you for further guidance.
Thank you very much.
Thank you, doctors and everyone, the panelists, the speakers, and also attendees. Thank you very much. Thank you very much for this session.
Thank you so much.
Thank you very much, Dr. Jain.
And then importantly, it will be the recording of this webinar will be available on YouTube, Enoch DigiConnect webinar platform on YouTube. So people who may have missed some slides, they can go back to Enoch DigiConnect webinar platform and watch the slides as well as the talk once again if they want. They can also share their colleagues and in their network.
Sure, so I think it'll be helpful for them for their corporate presentations to present to the managements about COVID. They can use that.
Thank you so much.
Thank you very much.
Thank you all.
Thank you very much, sir. Thank you very much, Dr. Jain.
Thank you very much.
Bye. Good night.
Bye. Good night.